Gregory Stafford.
Thank you very much, Madam Deputy Speaker. Despite having worked in healthcare for most of my career and being on the Health and Social Care Select Committee, I have to say, listening to the speeches thus far this evening, I feel in awe of the experience of honourable members on all sides of the House, but especially the honourable member for Shipping Sheppey and my honourable friend from Runnymede and Weybridge. And also I want to commend the extraordinarily powerful speech from the honourable member for Dorking and Hawley, who I know is supported by my right honourable friend, the member for Godalming and Ash. Madam Deputy Speaker, this bill is essentially about the duty of care. The duty of care to those who have mental health issues, but also to the public, which include the family, the friends, the carers, the public servants, and all those who interact with that individual. But also it's there to protect them from themselves. Indeed, as many members have said, it should be our hope and our ambition that as few people as possible find themselves in a crisis situation. And therefore I entirely endorse and support comments about ensuring that we have proper and well-funded mental health services, both in the community and in the acute setting. Yes, sir.
I thank my honourable friend for giving way. He mentions the point about the support for the person needing help, to help themselves, but also help people from society. Does he agree with me that today, before this bill is passed, more and more people get in a situation where they are not feeling that they're being helped and that they're just feeling incarcerated and restricted?
Well, I agree with the honourable gentleman to the point that, as far as the point he makes, that more can be done to help people in crisis. What I would say, however, is, and I think my honourable friend from Runnymede and Weybridge made this point, that there are people who are at such a point that they do need, unfortunately, to be incarcerated in order to help themselves and hopefully spend that time in incarceration, not just being taken away from society, but actually treated effectively and appropriately. But this brings me on to the point that this is a balancing act and it is a difficult situation. But I think we are all clear on all sides of the House that the current situation and the current act is no longer fit for purpose, especially when we think about forensic mental health. So I'm glad that the government is taking forward this legislation, which was started under the previous government, and I think the cross-party consensus that we've had this evening is reflective of the fact that this piece of legislation has come from both of the major parties sitting in the House. Now, Madam Deputy Speaker, I'm likely to be on the Bill Committee after the Whitsun recess, so I won't test the patience of the House by going through every single bit of this legislation that I have some interest in and concerns about, but I just want to raise briefly three important areas that I'm pleased actually that members in the House in the other place raised. A number of opposition amendments which I think would strengthen this bill, and I hope that they will be carried forward when we get to the Bill Committee in our place. The first is around reducing the unnecessary police involvement. The Noble Lords, Lord Kamal and Baroness May, tabled some amendments which represent, in my view, a very significant and much-needed shift in how detentions and removals under the Mental Health Act can be managed. Under the current framework, the power to detain and move individuals to a place of safety, particularly under sections 135 and 136, is largely restricted and falls under the responsibility of police officers. These provisions, while designed to protect the public, can often result in the criminalisation of people in acute mental health crisis, even when there is no threat of violence or risk to others. The amendments that were tabled in the other place would allow authorised and qualified health professionals, such as paramedics or approved mental health professionals, specialised nurses, to carry out those detentions and move individuals under sections 2, 3 and 5 of the Act. This would relieve police officers of the responsibilities that fall outside what is frankly their core expertise, while also reducing the stigma and trauma associated with police-led interventions. It would streamline the process, ensure individuals are supported by professionals trained specifically in mental health care, and maintain police involvement only where there is a clear and present risk to safety. In doing so, this would change significantly and strengthen the system and place mental health crises more firmly within the domain of health rather than in law enforcement. Yes, I will briefly.
Thank you for giving away. The current Mental Health Act, Section 136 and Section 135, which give the power to the police to break into someone's property or detain somebody from a public place where there are possibility of involvement of weapons, do you think, the honourable member think that a health professional will be able to manage those situations? Is it not the police should be the best people to deal with those kind of situations?
I'm sorry if I wasn't clear for the honourable gentleman. I thought I made it very clear that I was talking about situations where there was no risk to other professionals. Clearly, in the situations that he described, the police are entirely the right people to be involved. The second area that I want to touch on, Madam Deputy Speaker, was around strengthening safeguards for vulnerable children. What I would like to see is essentially an introduction of an essential safeguard for children and young people within the mental health care system. The current legislation allows, as I think the Honourable Member for Rumney, Mead and Weybridge mentioned, allows for a nominated person to be appointed to represent the child's interests. But in my view, it does not provide adequate protection against the risk that this person could be coercive, abusive, or in other ways inappropriate, particularly in cases involving looked after children or those with complex family dynamics. So I would like to see amendments brought that address the gap by establishing clear criteria for those who could be appointed as a child's nominated person. For looked after children, the local authority would automatically become the nominated individual, ensuring oversight by a public body accountable for the child's welfare. For other children, only individuals with legal parental responsibility, such as a guardian or someone named in a court order, should be appointed. These measures ensure that no vulnerable child will be exposed to undue influence during what may be one of the most difficult and disorientating times in their life. It aligns mental health law with broader child protection standards and reinforces the principle that safeguarding must be at the heart of any mental health intervention involving children. Finally, Madam Deputy Speaker, I also want to see amendments brought that would bring more patient voice and accountability. I accept that the bill as comes forward does make steps in the right direction, but I would like to see an amendment brought which mirrors that which was brought by the Noble Lord Howe and Lord Kamal in the other place, which would introduce a valuable and forward-looking provision, namely a mandatory debrief session within 30 days of discharge from detention under Part 1 of the Act. This session will be led by an independent mental health advocate and provide patients with the opportunity to reflect on their experience, raise any concerns about their treatment, and offer feedback in a safe, supportive and non-judgmental setting. This is more, in my view, than just a procedural addition. It represents a shift in culture, which I think we would all agree with, towards embedding patient voice and accountability into the mental health care system. It recognises the importance of empowering individuals after detention, supporting their recovery and learning from their lived experience to improve future services. I know that mental health charities and third sector organisations have strongly endorsed this proposal, and so therefore I do hope the Minister in his wind-up will make some indication that he would be supportive of an amendment that was similar to this. Madam Deputy Speaker, taken together, these reforms prioritise professional clinical opinion, safeguard children from inappropriate influence during periods of acute vulnerability, and elevate the patient voice in the post-care process. In doing so, they align the Mental Health Act closer to modern standards of care, international best practice, and evolving public expectations. I believe these amendments are essential to strengthening this bill, ensuring that our mental health system becomes not only more effective, but also more compassionate, responsive and just.